Hi, everyone. I'm Larry Gifford, president of PD Avengers. Thank you for joining us for this special webinar focused on care partners and the importance of a good night's sleep. Sleep, as many of us know, is a precious commodity, especially when you're supporting someone living with a chronic condition. We all recognize how transformative a night of solid sleep can be. It sharpens brain performance, boosts mood, and supports overall health. In fact, sleep is so crucial that it takes up roughly a quarter to a third of our entire lifespan. And that's not just downtime, it's essential time. Sleep plays a vital role in what scientists call brain plasticity, the brain's incredible ability to adapt, grow, and respond to new information. Without enough quality sleep, our ability to process what we've learned through the day becomes compromised, making it harder to retain that new information. Even more fascinating, researchers believe that sleep helps remove waste products from brain cells, waste that builds up during our waking hours. When we don't sleep well or get too little sleep, these natural housekeeping processes in the brain don't function effectively. In today's webinar, we'll dive into sleep matters so much, not only for brain health, but also for care partners' overall well-being. Whether you're caring for someone with Parkinson's or another health challenge, getting enough rest is essential, not just for them, but for you. Let's get started. We have some great insights to share with you today, so stick around. You won't want to miss this. All right, we're fortunate to have three amazing guests with us today, each bringing a unique perspective and expertise to the conversation about sleep and caregiving in the Parkinson's community. First off is my wife, my partner in Parkinson's in life, Rebecca Gifford. Rebecca, hello, thank you for being here.
Hello, thanks for having me.
And you're also a passionate advocate for the Parkinson's community with years of firsthand experience navigating the complexities of caregiving. You bring valuable insights into how sleep, or the lack of it, affects both the person with Parkinson's and the care partner. Brian Magennis. Brian is a nurse and care partner offering a dual perspective on both the healthcare and caregiving challenges of living with Parkinson's. His experience gives him a deep understanding of how sleep affects day-to-day caregiving and patient care. Brian, thanks for being here.
You're welcome. Nice to be here.
And Dr. Okeanis Vaou. Dr. Vaou is a movement disorder specialist at UT Health in San Antonio with extensive expertise in treating patients with Parkinson's disease, atypical Parkinsonism, essential tremor, and other movement disorders. She's also a board-certified sleep specialist, bringing critical knowledge about sleep disorders in patients with movement disorders. Dr. Vaou's blend of expertise makes her a key voice in today's discussion. Thank you for being here.
Thank you so much for inviting me.
Okay, so here we go. In this section, we're going to share the findings of the PD Avengers Sleep Survey, providing insights into sleep challenges faced by care partners. All right, so we got the Sleep Study 2024 surveying late evening effects of Parkinson's, conducted by the PD Avengers. This was from March 18th to May 18th of this year. Just some considerations to throw out there before we dive into it. This data offers valuable insights into the characteristics of those who participated in the research, which help us better understand and interpret the findings. It should not be used to make general assumptions about the entire patient or care partner population. This data set includes those that did not complete the full survey, but chose to complete a section of their responses. This means that total responding to each question is going to be based on the number that responded to that question. To strengthen the sample, we have at times combined categories like characterizing Parkinson's mild, moderate, significant, advanced, or profound. Some slides will show significant plus to indicate it's been combined with categories advanced and profound. Gender reporting, the data set includes at least 6 genderqueer respondents. And while AbbVie is a great partner, the survey was designed and executed by the PD Avengers, and the data was analyzed and extrapolated expertly by Social Signal. And this survey could not have been possible without you. Thank you. So why a sleep survey? Well, most people do not know and do not understand how lack of sleep impacts my Parkinson's, says this person in Canada that we will not reveal. But a lot of people were talking about this, about how it's such a difficult thing to talk about and for people to understand. And I wondered, Dr. Vaou, if you've encountered that, like how sleep impacts the whole body and the whole day.
Yeah, it's extremely common. I see it in clinic with my patients all the time. First of all, we have to say that sleep disorders is the norm in patients with Parkinson's. Patients are not sleeping well. They have either trouble falling asleep or staying asleep, and that's because of many things happening during their sleep. Either they have a condition called REM behavior disorder, or restless leg syndrome, or they wake up and they have tremor. That fragments their sleep, and that impacts their day. They're very sleepy, and they also they see their symptoms are worse during the day. The management of their motor symptoms are worse. So overall, it's something that we discuss at length in clinic, because it will be, again, the rule, not the exception. So as a provider, I always ask about their sleep, and their sleep in general will affect their daytime sleeping, the daytime sleepiness if they feel sleepy, their quality of life, their activity level, and also their mood. So helping manage their sleep can also help these daytime symptoms and their quality of life overall.
And how can chronic sleep issues impact the long-term health of the care partner?
Very good question. Like you mentioned, if a patient is not sleeping well, then of course the care partner, granted that they're sleeping in the same bed, will also have trouble sleeping, because the patients wake up multiple times, and then the caregiver will not sleep well. Or if they have active dreams where they're acting out their dreams, then the caregiver will wake up, or unfortunately may be kicked by accident or poked by accident. The caregiver will wake up. So the caregiver is also sleep deprived, which that affects the quality of sleep, the quality of life of the caregiver. And when the caregiver is tired, and that can affect their mood, and also will ultimately affect the way they care for their Parkinson's partner. So it's very important that they both sleep well. Another thing I want to mention is that they may not end up not sleeping in the same bedroom, and that has other implications which we'll talk later on.
Right. Moving on to Brian. Brian, from a healthcare perspective, sleep deprivation has profound effects, not just physically, but emotionally as well. Can lead to burnout, increased stress, even depression. What bedtime routines have been found helpful in preparing for a restful night's sleep?
So from the person living with Parkinson's perspective, there's various different causes of sleep disruption, and good sleep hygiene is a very basic strategy. Going to bed, having a good routine, and not drinking too much water or liquids before going to bed will decrease the number of times that the person is up to use the bathroom. Looking at the environment, that the environment isn't too hot or isn't too cold. Even something as basic as looking at the type of pillow that you use, that you sleep on, how many covers that you have. A few of my patients even like to wear bed socks, because it's been shown that if your feet are cold, you just won't sleep well. Then really focusing on the person's motor function. How will they move and get in and out of the bed and can turn in the bed? How dark the room is. Do you blacken the blinds? Those type of things. Or do you sleep with a night light on? If the person is up and out of the bed going to the bathroom frequently, you want to reduce the risk of a fall, tripping over things. And falls can usually happen at night when people go to the bathroom. From a care partner point of view, again, exercising during the day with the person with Parkinson's can really make the brain tired enough to go to sleep at nighttime. Having that good routine as well throughout the day will be able to get the nighttime routine into a good stance. Over the night, again, as Dr. Vaou mentioned about the REM sleep behavior disorder, a lot of these issues rarely in, say, general clinics get mentioned to the physicians and the clinicians. So it's a really good tip for the care partners and the person with Parkinson's to mention these things. We in our movement disorder clinic always have a checklist that we go through, and sleep is up there in one of the vital questions to ask. So if you don't ask, you won't really get the matter resolved. That's kind of mainly it. I'll probably go through a few more things later on.
Great, thank you. We've got a new screen up here. Our relationship suffers. It's difficult to maintain intimacy when we're both exhausted. Parkinson's doesn't take a break. It impacts us 24/7, and its cumulative effect is exhausting. Rebecca, I would love to bring you in here and just get your thoughts on sleep and the importance of it from a care partner perspective.
Well, these quotes that you have up right now resonate with me a lot. I'll back up just a little bit and give you a picture of give our watchers a picture of our sleep story. Early in our Parkinson's journey, sleep wasn't as much of an issue. It was kind of a slow build over time. And then we were experiencing some of the things that Dr. Vaou was talking about, where Larry started acting out his dreams, being quite active at night, talking a lot, having full conversations quite loudly, and you hear his voice. So that's a significant voice in the bedroom at night. And it became, and then he fell out of bed a few times. Simply because he wasn't able to turn over one way, because I was also in the bed. And so we found that we were both suffering and not having great sleep. And that was affecting our relationship. For this quote right here, the relationship suffers. It's difficult to maintain intimacy when you're both exhausted. My mood was affected. I was more irritable. I was less able to be present with Larry and with our son. So it affected our family life quite a bit as well. And then beyond that, previous to these experiences, our bed was kind of a sacred space, because that's where you have close conversations at the end of the night or the end of the day, when you check in and talk about your day and what's going on with you. Maybe you didn't have that opportunity earlier in the day. This is where intimacy happens in all forms. It could just be touching. It could be sexual intimacy. This bed space was kind of where all of that happened during nighttime when we shared a bed. And so all of that got disrupted. And so it did affect our relationship a bit, as far as feeling close, feeling intimate, having less of that intimacy. Besides the fact of just kind of feeling that hypervigilance of, okay, now Larry thinking I don't want to move around too much, and I want to make sure that she gets sleep and I get sleep, and me thinking, okay, well, what's going to happen? Is he going to accidentally kick me or push me in the middle of the night, which happened a few times. That, and not really being able to relax in that space. So it really did affect our relationship and that intimacy time as well. And we can talk about it more later, but we did ultimately make the decision to sleep separately. And that has had a positive effect on our relationship. And I know that comes with a lot of stigma and perceptions and hesitancy on our part to do that as well, for lots of reasons. But that was ultimately the decision that we needed to make for ourselves, to prioritize our own sleep, which we understood by then was very much affecting both our health and wellness and our relationship.
I'd like to bring in Dr. Vaou here. Dr. Vaou, does that resonate with you? Does it sound familiar, or are we oddballs?
No, this is, again, that's what I hear from my patients, from their caregivers. They are struggling initially to sleep in the same bed, and the caregiver suffers. And eventually, yes, they do. A lot of the times they do sleep in separate beds. The interesting piece is that when I first ask the question, do you sleep in the same bed or not? And they say, no, we've separated for a long time now, because usually acting out of dreams was the main reason. My other question would be, so did you try to treat this? And sadly enough, they don't know that this is a treatable condition. And I'm talking about the REM behavior disorder, the acting out of dreams, it's very prevalent in patients with Parkinson. So then we start working on that. And most of the times, or a lot of the times, the caregiver returns to sleep in the same bed, and that helps their marriage, their quality of life overall, their relationship.
Well, that's great to know. This slide shows the number of people with Parkinson's who characterize their Parkinson's as being significant, advanced, or profound was 1 in 4, 25%. And then sleep disturbances are highly prevalent in PWP, with many reporting issues such as insomnia, frequent awakenings, REM sleep behavior disorder, and difficulty turning in bed. 96% of the people we surveyed say they have their disease affects the sleep quality with an average of 2.75 sleep disruptions per night. Also, an average of 5 symptoms were reported each night, illustrating how widespread and disruptive sleep problems are for people with Parkinson's. And the survey shows that PWP experience a complex set of symptoms that worsen at night, such as nocturia, stiffness, anxiety, tremors, and vivid dreams. Each symptom can affect sleep in a unique way, making it difficult to find a one-size-fits-all treatment approach. Brian, I'd like to talk to you about managing those nighttime symptoms and disruptions. What tips do you have on recognizing and addressing the symptoms that interfere with sleep?
Yeah, so you've mentioned the very common ones, and they do fall into those 5 categories. And the motor symptoms, obviously, in conjunction with your clinician, you can look at the medication that you take at night that help treat the motor symptoms that you can turn in the bed and get in and get out of the bed. We all move hundreds of times a night around during our sleep, and for somebody with Parkinson's, that can be a lot more difficult. We have little tips that we give our patients, maybe looking at the sheets, having silky sheets that you can slide easier, having a bed lever at the side of the bed that you can hold onto and turn easier. I mentioned about the frequency of going out to the bathroom, and there's good medications that can control bladder behavior at nighttime, as well as reducing the amount of fluid intake that you have. The vivid dreams and nightmares and the REM sleep behavior, Dr. Vaou mentioned, again, it's bringing these issues up at the clinic visit or even at your local doctor, that these symptoms and sleep issues are treatable, they are controllable. And even the other things at nighttime where somebody can't fall asleep, the insomnia, that can have a huge impact. And then what the person naturally tends to do is go down and have a cup of tea or a cup of coffee, or turn on the television and they have the blue light where they're looking at their screen, maybe on their cell phone, and looking at YouTube or any other different apps on the phone. And again, that's going to keep them up and keep them awake during the nighttime. And next of all, they see it's 2 a.m. and they still haven't fallen asleep. So all these things, again, with very simple strategies, can really help change that pattern and make the person sleep that bit better. It has a huge impact on the care partner. And my dad has Parkinson's for many, many years, and my mum is the care partner at home. And she would say that Dad, with the advancement of his condition, has moved downstairs because he has a hospital bed downstairs, and she was upstairs. And she always had this fear of what would appear in the morning time as she came down. She'd have this anxiety about would he be on the floor, or, you know, what sort of night he had. So she actually moved downstairs too. And that has helped her from an anxiety point of view, but she is sleeping better because she knows she's in the same room, and just psychologically and emotionally that has a better impact for her night's sleep.
And what's your personal philosophy regarding naps?
I would be a big advocate for napping. It's not for everyone, but I think the brain, sleep has a huge impact on the brain and has a huge impact on the motor symptoms of Parkinson's. So the better you sleep, you wake up on, from an on-off fluctuation perspective. Napping, it depends. Usually I say to my patients, have a nap around 2 p.m., no later than 3 p.m. And what works for people are different times. I would say 20 minutes to 90 minutes max. Usually, on average, try to go have a purposeful nap, go up, lie down, shut the curtain, set the alarm, lie down in the bed, have a purposeful nap for maybe about 40 minutes on average, and you'll feel that benefit when you wake up. I think it's a really good thing for the brain. There might be different opinions from sleep experts, but once you don't go beyond late afternoon having that nap, you won't eat into your sleep time at nighttime. And a lot of people feel really refreshed after a nap. I know I do. Sometimes at the weekends, if you have a bit of a nap in the afternoon, 20 minutes, half an hour, you feel a lot better. You feel that refreshment. And the brain gets rejuvenated and the batteries get recharged. So
Yeah, I
I'd
think
be
a nap every
a
day.
big advocate for napping, yeah.
Yeah, I nap every day. Dr. Val, we actually have a sleep expert with us. Dr. Val, what's your thought on napping?
So I do have a few thoughts, which are, so let me start by saying that sleep is very interesting as a function for everyone, for all species, right? It's not us who sleep, but also the way we sleep, the force of sleep or the sleep drive is basically a force that accumulates during the day with different activities that we do, mental or physical. So the more mental activity and physical activity that we do during the day, the better sleep we'll have, because that sleep drive ends up being, if we're very active mentally and physically, that sleep drive will be more like stronger than someone who leads a sedentary life. So having said that, that's our aim for a good night's sleep. We want to build that sleep drive throughout the day. If we interrupt that sleep, if we nap during the day, that means we will deplete a little bit that buildup of the sleep drive. So I'm not saying do not nap. I'm saying yes to napping, but only for a cat nap or a short period of time. So not more than 20 minutes. And actually, that's what the American Academy of Sleep Medicine also recommends. If you absolutely have to nap and you just can't stay awake because you have not slept the previous night, it's absolutely acceptable to nap, but only for a short period of time, because the longer after those 20 minutes or 30 minutes, you will find yourself that you have decreased that sleep drive. So come nighttime, you will not help yourself. You're not going to be as exhausted to really get into a good night's sleep. Now, having said that, there are many reasons why patients with Parkinson's do not sleep well. Yes, we mentioned the motor symptoms. There's also psychological. So if they have anxiety and depression, that adds to their sleep fragmentation. They could be the medications. Some of the medications actually wake them up. Dopamine itself is a stimulant, so it wakes us up. The good news is that if you take a long-acting carbidopa, levodopa before bedtime, that will eventually help patients throughout the night, because they're not so off and stiff, and they can turn over easier. They don't have cramps. They don't get into what we call the off dystonia, which is a painful foot cramp most of the times. So it is helpful, but there are some medications that might be stimulating. So there's a lot of reasons. And when most patients tell me that they can't sleep, I certainly do not jump into, oh, here's a hypnotic, because most of the times the hypnotic is not the answer. It might be a Band-Aid that will help the patients fall asleep fast, but they will certainly wake up multiple times because those underlying problems are still there. So we really have to peel that onion to figure out what the cause is and address that particular cause. One or more. It depends on what the cause is.
Yeah. Back to the survey here real quick. Sleep issues often are underreported and undervalued in clinical discussions. Doctors tend to focus on the motor symptoms, while sleep disturbances are sometimes seen as secondary. So we had 72 people discuss sleep with their doctors, but only 20% diagnosed with a sleep disorder. Dr. Vaou, I'd love for you to comment on how this reflects your experience. I know you talk about sleep disorders, but do most MDS?
Yeah, again, very good question. As your survey suggests, and other surveys we know that sleep had not been such a big priority in the movement world. It now is becoming more important, and we are raising awareness finally that it is very important. So more and more movement specialists are asking about sleep. we have to do a better job with general neurologists and primary care providers. I have multiple examples where patients come to me from being cared by primary care providers or general neurologists. And as we know, the majority of patients with Parkinson's are cared by general neurologists and primary care providers. So when they come to me, they tell me that their issues of sleep have never been addressed. Or one thing I want to point out, and this is very important, I hear it over and over and over again, patients are not aware of their REM behavior disorder as a separate disorder. They think it's nightmares. So they very frequently, I don't know if Brian will agree with me, very frequently tell their providers, their primary care providers and family doctors that, oh, I have nightmares. So by saying that, then that is not really recognized as REM behavior disorder. They're like, oh, you have nightmare. And sometimes they even give them medications that address nightmares, such as prazosin. And of course, that does not help for REM behavior disorder. So we do need to raise awareness that is absolutely true.
Well, and perhaps it's important to in that situation then to include the care partner in the sleep conversation, and then make sure that the care partner is there at the appointments and can address that as well, because the care partner, I'm certain, is aware of any nighttime issues going on. And so it's, how are we sleeping today? How are these days? How are we sleeping as a couple? What sleep issues are you dealing with? And then kind of addressing it from that standpoint. And then you probably get a little bit more accurate information in some cases.
That is so true. As a matter of fact, not only do I include the care partner in the conversation, sometimes when it comes to REM behavior disorder, I do not ask the patient because the patient will not know. I'm like, so tell me about what's happening at night. So yes, it has to be with a combination of both the patient and the care partner.
And a feature of the REM sleep, these vivid dreams, they're usually always of being in a fight or being chased or an argument. That's a feature for some reason. I don't know the explanation of it, but the majority of the patients would always say that this is what the dreams. And if you ask the right questions, you'll get the right answer. And as you said, Dr. Vaou's always asking the care partner in the room. And I've set up a family care clinic as well as the patient clinic where we ask these questions, because it's very important to get the care partner and the family's perspective on it, because they're living with it 24/7 too.
That's great. Thank you. Rebecca, 88% of caregivers that we surveyed report their sleep is disrupted due to their partner's PD symptoms. I'm sure that this resonates with you.
It does. I'm not surprised at that high number. It's certainly the PD symptoms, and we happened to know that going in that because we had friends who had experienced this and had already made the decision to sleep separately, where the person with Parkinson's was having REM sleep disturbance and had pushed and kicked and pushed out of bed and all the things that happen, and that can be quite scary. We were aware that might happen, but we were lucky enough to have a few years there in the beginning where we weren't dealing with that. And then when it showed up, we kind of knew exactly what was happening, but that didn't make it any less disturbing. It was like, okay, here we go. We need to make these decisions now and really think about prioritizing this, make some changes.
Well, you mentioned stigma earlier. What would you say to care partners who feel guilty about prioritizing their own rest over their care partner or caregiving tasks?
I would say I completely understand that reaction. As care partners, we are so accustomed and it's almost a habitual thing to prioritize other people and their well-being over our own. It just becomes a part of how we live and prioritize our time. It's not always the healthiest thing, but that's certainly a normal reaction for myself and for the care partners and caregivers who I know, to feel a sense of guilt about taking care of yourself or prioritizing your own sleep over somebody else's. But also it's over time. So because of that, it took me a little bit of time to learn to prioritize it and really make some of those tough decisions and understand that it's necessary. Because I was going a period of time without very good sleep, it became a really good way to learn and become hyper aware that that sleep is necessary to my own well-being and for me to be able to live my life. And then part of that life also is caring for other people. So with better sleep, I'm able to do all things better, including caring for Larry when he needs care and for my son. And so it doesn't, so a very normal reaction. Yes, I understand. And also we do need to make it a priority. It is necessary to your well-being. It's necessary to you being able to live the life that you would like and to have normal health and wellness.
And
Dr. Vaou, at what point should a care partner or person with Parkinson's seek help with their sleep? Like, what are some of the telltale signs that you
Yes,
need
of
help?
course.
You're going to need some expert help.
Before I answer that question, I want to add something that Rebecca said. I want to add a fact that we, as you may know, that patients with Parkinson's are mostly men. There's a higher ratio than women, and women caregivers are women are, how should I say, programmed to be more of caregivers, and they have this tendency to, like you said, you know, I'm designed to care for my son, for my husband, and I come last. So that's known that women tend to put themselves last. But yes, I agree with you. If you don't get good sleep, then you're not going to be on top of your game to be able to care for Larry better and for your son better. So kudos to you. So back to your question, Larry, on when do they recognize? Well, anyone who doesn't sleep 7 hours continuously should definitely seek help and mention that to their doctor. Same thing goes for the caregiver, and because that will eventually impact their day. They will be more sleepy, they will be more moody, things that we already mentioned. And we in general tend to dismiss these symptoms, and I have a lot of people who say, oh, I'm designed to sleep 5 hours and I can do it, I'm fine, but not in the long run. So the brain does need those 7 to 8 hours to clear all those toxin buildup that we have throughout the day. As you also mentioned, Larry, earlier, that it is the sleep is kind of like the washing machine of the brain at night, and then we wake up refreshed and ready to start our day all over again. So we should never neglect the power of sleep that we are now, as a scientific community, understanding, and we are paying more attention to. So so once you recognize moodiness, sleepiness, lack of energy, fatigue, things like that, both the patient and the caregiver, they should definitely address these symptoms to their doctor. Another thing is what you mentioned, intimacy. So if that is impacting their intimacy, their relationship with their partner, as well as their relatives, their children, work, things like that, these are certainly things that may be related to poor sleep and sleep deprivation.
Yeah, the quote that's up, in order to help my husband get a good night's rest, I now sleep in a different room. Great impact on our intimacy, as I feel that I'm more of a burden than a wife. This was written from the PWP's point of view, but there is a perception. It was really hard for us to make that decision to sleep in separate rooms, and it's not the decision for everyone. That's what worked for us, and is working for us. But a major consideration was that intimacy part, and it's all forms of intimacy. And a lot of that we were reserving for that time, that bedtime, previous to these issues. But what we have learned is that expanding our idea of what intimacy means, making time for it, having it be a priority throughout our day, scheduling it at other times to make sure that we're connecting in all ways, being just more intentional and deliberate with it was what was necessary for that. And because of that, we now perhaps are more intentional, more present with that time when we make it. So in some ways, it has improved that level of closeness. And so if you think about it from a greater perspective of, it's not just about bedtime and sharing a bed. That's not the only place that you have intimacy with your partner. And intimacy is in the broadest sense is talking in a close way and sharing things that are meaningful and important to you and emotional, having emotional moments, sharing important experiences, just normal touch, holding hands. All of those things can happen outside of the bed and outside of bedtime. So we just have to think about it a little bit more. And so I think that's an important point to make, because there can be some stigma, and as we had hesitation and reservations about doing that, because what does that mean for a marriage? Does that mean that we're not working anymore? Does that mean that that our marriage is struggling or troubled because we're not sleeping in the same bed, because that's the way that we're programmed? That's a stigma that's been put on that about other marriages that we've seen, or things that you hear, or media and whatnot. And so we had to kind of overcome that and decide that this is what was best for us. And it kind of didn't matter how it was perceived, and that our marriage was still going to be a priority, and that sleep was going to be a priority, because we learned that sleep really needed to be a priority for our relationship, for our health, and in all ways.
Brian, I wonder if you have anything to add to that.
Yeah, I was just going to say that's a really, really good point about scheduling intimacy throughout the day. It doesn't necessarily have to be at night. You schedule exercise as part of your day. You schedule meal times as part of your day. So why can't you schedule intimacy for that? It's whatever works for the couple and the person. One of my patients, he always makes a funny point that, they sleep in separate beds, himself and his wife, and she comes in last thing at night, and they have a little cuddle, and then they say good night, dear, and go into their separate rooms, and then kind of make a bit of fun of it, and see the funny side of it more so than because it can spark off really thoughtful emotions and upsetting emotions that now I have to leave the marital bed as such. But again, sleep is important. Scheduling intimacy is just as important. So it's the way you view it and the context you take it in is really important again.
All through the years, I've been practicing over 12 years now. Most patients come in with their spouses, which is higher than the norm of other non-Parkinson patients, other patients I see. So it is recognized that patients with Parkinson's have more stable marriages, and possibly because of a certain personality. And this is something that we see over and over again. And we do see, although the caregivers have a lot to deal with, they have a lot on their plate. Sleep deprivation is one big issue. Decreased or lack of intimacy, another big issue. They stick to their husbands or their wives much more than we would be expected. So, that is something that we definitely need to acknowledge. And it's something that we do see in clinic frequently with our patients. They all come as a couple. And there are other struggles that caregivers have, not just at daytime. There's other things which is not part of this webinar, but these may also be more burdensome. The caregiver burden in general is very high, but despite that, they are really a very strong unit as a whole.
That's great. 74% of caregivers that we surveyed report increased emotional and physical strain due to lack of sleep.
Absolutely. And physical strain, yes, but for me, I noticed my health taking a downturn because I had less energy. but also because I had less energy, I was exercising less. And for me, exercise is a big part of my own wellness, and both mental health wellness and physical wellness. So I that resonates with me on lots of a little bit of increased emotional strain as well, for all the reasons that we've talked about, where if you're sleep deprived, you're less able to be present, you're less able to have a balanced mood, you're less able to control your reactions to things, you're more emotionally volatile. All of those things come with sleep deprivation in my experience.
I'm going to go through 3 quotes here real quick. It makes me sad that we will have to sleep apart eventually, and worries me if a kid gets in bed in the night with his RBD, if he accidentally hits the child like he's done to me a few times previously. And then 1 in 4 say their sleep is disrupted a lot or a great deal. Every night I wake up multiple times to help my husband turn in bed. It's exhausting and takes a toll on my own health care. And then sleeping in a separate bed would be less stressful for me. However, after 48 years, this move would make my husband feel abandoned. A restless and thrashing Parkinson's night sent me to an ER for stitches. So here we are talking about RBD again, and somebody who knows that they should be in a different room, but their husband would feel abandoned if they did that. So that's another factor in all of this too, because most of the people that are getting Parkinson's are older and have been married a lot longer.
Well, I think that comes down to communication and being willing to communicate and have that tough conversation. Larry and I have talked about this many times, of the tough conversations and keeping your communication channels open, even for the things that are really difficult to talk about. And so there might be a compromise or a way that they can find a way to sleep separately part of the night, or whatever they can work out, if they're willing to talk about it.
Brian,
Just
do you have
from-
any insights here?
Yeah, just from a positive perspective, as Dr. Vaou mentioned earlier, a lot of these sleep symptoms are very treatable. Like the REM sleep behavior, the motor issues at nighttime, the urination issues at nighttime, a lot of these are treatable. And it's just for the person with Parkinson's and the caregivers to say it at the clinic visits. Or even, I'm not too sure about the States and Canada, but like I'm a Parkinson's nurse specialist and advanced nurse practitioner, and I have a phone line, and people ring me all the time with these issues, or they can contact me by email. Having that link person that you can get very familiar with, and they get to know you and get to know your condition, is vital in the management of these chronic conditions, because these conditions progress, and if they're bad now, it's only going to get worse in the future if it's not identified and treated effectively. So we have to be very positive about these situations for people, that they are treatable. And it's just having a good assessment of the symptoms, having the person who you attend who's knowledgeable and able to make a difference with the treatment that they can provide.
Dr. Vaou, do you have any thoughts?
On the treatment of all the symptoms, or of
Yes.
all the sleep disorders. So taking a step back, every patient I see, I always ask about their sleep. And the usual response is, it's not good. His sleep is horrible, or my sleep is horrible. And then I start dissecting what it really is. What does horrible mean, or what does not good mean? And there's a algorithm that I always go through with the patient, looking at, is it mental health? Is it mood? Is it anxiety? Is it, sometimes patients have psychosis where they have hallucinations, or they have like delusions that may prevent them from falling asleep or being very anxious. They have the motor symptoms that we talked about. They can turn over in bed. We call this hypokinesia or bradykinesia. They might have dyskinesia that prevents them from falling asleep. And they might wake up in the middle of the night, go to the bathroom, and then come back and can't go back to sleep because they have their tremor is there and it's preventing them falling asleep. So that's when you want to treat those tremors at night. Then there's also something we didn't mention, and that's pain. Pain can be a symptom of Parkinson's, and it can be an indication that they're low on their meds, so you have to treat that. There's also the urination piece, that there's treatment for that. I always go through their medications, making sure that there's nothing that the patients are taking that would wake them up. Let's not forget that patients also, like the rest of the excuse me, population, may also get other sleep disorders, such as sleep apnea, that the rest of the population has. So we also need to address that aspect and maybe do a sleep study if we think that they might have sleep apnea. And there's also the behavioral aspect. So like, what do you do? Kind of like a little bit of what Brian said. What do you do? What is your sleep hygiene just before going to bed, a few hours before going to bed? Are you exercising? Are you getting into heated discussions? Are you drinking alcohol? You know, these things that you should not be doing going into sleep. Are you watching TV in bed? Remember that the bedroom and the bed should only be used for sleep and intimacy, nothing else, not watching TV, not even reading a book. You do everything outside the bedroom, because that's how brain usually associates the bedroom with sleep. If you do other activities in bed, you will have trouble, your brain will have trouble recognizing that bed equals sleep. So these things before, during sleep, and then what do you do when you wake up? Do you turn on the light to go to the bathroom? That will wake you up. Or do you use a night light so as to, as Brian also said, try not to trip and things like that. So there's so many things to go through. And then what do you do during the day? Do you exercise? Do you nap for hours and hours? All these things are things that need to be addressed. I usually spend about 30 minutes in my clinic time with my patients trying to figure out what it is that we need to address to optimize sleep.
Well, and as part of that, oftentimes there's not enough time to address all the symptoms that somebody may be experiencing, especially because the symptoms at night are different than the symptoms during the day. And people don't necessarily recognize that sleep is what's causing some of their issues during the day. So they may not put that at the top of the list of the things that they want to address.
One thing though I have to mention is that there's definitely hope coming with, in terms of treatment of motor symptoms of Parkinson's. We're getting more and more medications that last longer, including the pump, the levodopa pump. So these are symptoms that can be, the nighttime symptoms can be addressed with longer acting medications. DBS as well is one of them.
Can I just add there, we focused a little bit on the motor symptoms at night, but as Dr. Vaou mentioned there, the non-motor symptoms, are just as important to assess and treat as well. And one particular one that comes to mind is profuse sweating that people tend to mention as well. And that can be a huge, huge problem, these drenching sweats at nighttime.
Yeah, that's no fun, by the way.
No.
I'll just tell
And
you
I find that this is a sign of wearing off. I've addressed a lot of those with long-acting carbidopa, levodopa, dopamine agonists.
Yeah.
All right. Care partners have trouble discussing sleep issues with others, according to our survey. And this is like talking to friends about it. I've got 3 quotes here I'm going to read, and I'm going to get your comments on it. My family can see my sleepless night on my face. There's no need to communicate. It becomes a competition, them saying how badly they sleep. And then I feel like I'm complaining. So Beck, do you ever talk to other care partners or even friends about the experience that you have with sleep and being a care partner for Parkinson's?
Yeah, and care partners are remarkable, and the care partners in my life are hugely supportive and open-minded, and everybody knows that everybody's experience is vastly different, and so that's where I can get some support. And I do get support from my other friends as well, but it is difficult for them to understand the situation, especially when we talk about sleeping in separate rooms, because again, we're programmed as society to see that as an indication that it's a troubled marriage, or they're not very close, things aren't going well, or they're at the end of their marriage in some ways. And so that requires a little bit of explanation. There is a stigma attached to that that does make it more difficult to share about those experiences. But I do find, perhaps I'm lucky, but I do find that the people who I feel I can trust with that information to talk about that with, once they understand the full picture and have a better picture of what we're dealing with Larry's Parkinson's every day, then they're fully on board and understand, and I can speak about that more frankly. But there are some misperceptions about that choice, for sure.
Brian, do you run into that at all?
Yeah, I was just going to say, I've seen it from my mom's perspective, that she has had great help from joining a carers support group. And, you know, people in the same situation coming together and talking about it really, really helps psychologically and reduces anxiety, and just the feeling that someone knows the situation you're in and can identify with the problems that you may have. And they're common across the board for all carers, really.
Yeah, I think the one where people start to talk about their sleep issues, and then people go, I have sleep issues too. The competition pictures light up, and it happens with Trimmer and everything else too. So I can see that happening amongst the care partner.
Isolation can be a huge issue as well. If the carer just feels really isolated and alone, and you know, there's no need to feel that way, because there's so much help out there. And looking for over in Ireland, we have the Family Carers Association, and they do great work.
Well, I call this Parkinson's. It's the lonely disease. Even when you're surrounded by people who get it, you feel, because nobody's symptoms are the same. So it's hard, and your care partners also feel isolated and alone as well, because they're having to do things that other people aren't. We were just talking about that the other day, Beck.
We were, yeah, it can be lonely in lots of ways, and then it becomes more intentional. And to Brian's comment about connecting with other caregivers and care partners, and really relying upon really making those connections priority as well. It helps your sleep, it helps your well-being, it helps all things, because you're just feeling like there is somebody who understands, there is somebody I can call in those really tough days, and I don't have to explain anything about it. It really does make a difference. You know, that said, there are always times when you feel kind of isolated and alone. I think that almost every person with Parkinson's and every care partner would could say that they spend a significant enough time feeling alone and lonely in their experience that it's worth commenting on.
Yeah, I said the other day to you that my mom, and I always bring this into my practice, that my mom often says, you know, no one asks me how I am, so I always ask the care partner how they are. And it has a huge impact, because the person with Parkinson's need their care partner.
Yes. Over 60% of care partners reported difficulty finding time for self-care activities, exercises, hobbies, due to the need for more rest during the day. Sleep deprivation leaves them with little energy or motivational for personal well-being. We've touched on this, but this is just another indication that how important the sleep overnight is in allowing you to take care of yourself so you can be a whole person. And then 50% of care partners indicate that sleep deprivation led to increased feelings of frustration and impatience with their loved ones, which caused guilt and strain in the relationship, making caregiving even more emotionally challenging. This is interesting to me. Half of the care partners that we surveyed get that the sleep deprivation increases their frustration and impatience. Beck, does that resonate with you?
It does. So reactions just become heightened and faster, and you kind of sometimes lose the ability to filter or consider your emotional reaction before you have it, or maybe we're more likely to have the emotional reaction. Absolutely. Does that resonate with you?
Oh, sure. Yeah, absolutely.
Yeah, but I was less patient with you and with your Parkinson's, I think.
Well,
when you don't have sleep.
Yeah, and my frustration, I have a shorter fuse than I used to. when it comes to feelings of frustration and impatience. But Dr. Vaou, does that do you find that in your practice?
Yeah, I do quite a bit. There was frustration, there was impatience. Usually what I'd like to do is, and sometimes I can feel it. I can feel the tension in the visit, and especially when there's the kids, the older, the adult kids, usually they're there and there's some tension between them. So I always address it and like, how's everything? Are you burned out? Do you feel like you're tired? And I offer options. So a lot of what's striking to me is a lot of caregivers and families don't know that there's other options, that they can get help. They can get some kind of respite. I involve our social worker when that happens. So I'm always quite vigilant in making sure that everyone, the whole family, is taken care of, and their well-being and their wellness, because it's important.
That's interesting, because they do tell us that once a person is diagnosed with Parkinson's, the whole family is, but then when it comes to getting treatment, they kind of leave the rest of the family behind often.
I don't know my dad any other way. I was only 18 months when my dad was diagnosed. He was 27. He's now 78.
Wow.
So it's
Wow.
yeah, so I don't know him any other way. I don't know him without Parkinson's.
It's amazing. The need for caregiver support varies significantly depending on the stage of Parkinson's and the severity of symptoms. I think that's pretty obvious. And then we have some call to actions here that I just want to share, because I think sleep and this survey is sort of a clarion call to the Parkinson's community, both the patients, the caregivers, the healthcare providers, researchers, and policymakers. Create programs aimed at reducing the nighttime burden on caregivers, acknowledging their critical role. Encourage open and ongoing dialogue between the person with Parkinson's, the caregivers, and healthcare providers, specifically about sleep. Develop and implement sleep-related interventions that address the specific severity and characteristics of symptoms in different regions. Healthcare providers should prioritize discussions about sleep issues during consultations, ensuring that sleep disturbances are diagnosed and treated appropriately. And increase awareness and improve diagnostic tools to distinguish between Parkinson's-related sleep disturbances and symptoms related to other conditions like menopause. And I'm hoping, as we talk about this more, that we'll be able to get more practitioners to take up the sleep cause, which Dr. Vaou has already. And thank you for that, Dr. Vaou.
It's just so funny when I just like, and to give you the hope, the closing hope. When I finished my fellowship training in movement disorders, I wanted to go into sleep because there was so much into sleep that I wanted to learn more about. So at the time, though, I was looking around to see, was there any value in this? And there wasn't anyone really being sleep trained and movement trained, because like, why do you want to do this? But thankfully, I see more and more people who have trained in movement eventually go to sleep as well, or vice versa. And I think that's very encouraging.
It is encouraging. All right, let's go through final thoughts and resources. Quickly summarizing the key takeaways here from today's webinar, we explored how sleep impacts both care partners and people with Parkinson's. We looked at the practical strategies to improve sleep and discussed the importance of building a personalized sleeping regimen. Remember, sleep is not just a luxury, it's essential for your well-being as a care partner. Rebecca, what are your takeaways?
I guess I would just offer some encouragement to my fellow care partners. I completely understand that it is hard for us to prioritize ourselves. And it may even be a habit these days to prioritize other people's care and well-being over your own. But this survey proves and gives us really strong data that, and we know that sleep is essential to everyone to be able to live the life that they want. Ours just happens to also include spending a lot of time caring for other people. So I think it's really important to prioritize that and to really take the necessary steps and consider it a part of necessary self-care. And that doesn't require, it may not require huge changes, and it might be really easily treatable, as Brian and Dr. Vaou have said, but to really make that a priority, and even with small changes, it can make a big difference. So be kind to yourself, take care of yourself, and prioritize your sleep.
Brian?
Just, I suppose, in summary, don't forget the very basics from a sleep hygiene point of view. But the number one for me is to bring these issues and the problems with sleep to the clinic, to the physician, or to your nurse specialist or practitioner if you have one. And it can be easily sorted once we assess it, and once we know what the issues are, we could work methodically to be able to make things better for you and the care partner, obviously, because you're both as essential in the management of Parkinson's as each other.
And Dr. Vaou?
Well, I'm going to echo what both Brian and Rebecca said, and I'd like to add that sleep is a vital piece of your wellness. So don't neglect it for both the caregiver and the patient. And sometimes it's not, a lot of the times it's like exercise. You have to have a certain structure to be able to sleep better and work for your sleep. And like you said, make time for your sleep, make adjustments to be able to sleep better. And yes, by all means, always mention it to your physician, even if they don't ask, because it's important.
We've covered a lot today, and if you're looking for more information, be sure to explore the PD Avengers Sleep Survey results, pdavengers.com/sleep survey. I want to thank all of you, Rebecca, Brian, Dr. Vaou, for sharing your insights and experiences with us today. Your perspectives have been invaluable. I'd also like to thank each of you in the audience for joining us and participating in this important discussion. Your involvement helps us create meaningful change within the Parkinson's community. So you can find a summary of today's webinar, recommended resources, and links to PD Avengers Sleep Survey results at pdavengers.com/sleep survey. Keep an eye out for opportunities to engage further through future webinars, support initiatives with the PD Avengers campaigns. And if you're not a member of the PD Avengers yet, sign up today for free on the website. If you want to register your organization, email me at larry@pdavengers.com. Also, remember that November is Care Partner Awareness Month. So you can go to pdavengers.com right now, pay tribute to your care partner on a special page we've created called Care Partners Shine Bright. And I want to thank you for your time, participation, and dedication to improving care for both you and your loved one. Together, we can continue to build a community where care partners feel supported and empowered. We also want to thank our friends at AbbVie for making this possible today. Until next time, be well, take care of yourselves, and most importantly, get some rest.